Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be reviewing a question that involves hip precautions following a total hip arthroplasty or a total hip replacement. A 69-year-old female is being evaluated by a physical therapist for a right posterior total hip replacement 4 weeks ago. What exercise would this patient most likely avoid? Option A, side-lying hip abduction. Option B, supine straight leg raise. Option C, side-lying hip external rotation. Option D, side-lying hip internal rotation. So now let's review each option choice to determine which of the following exercises would be least appropriate for an individual who has a right posterior total hip replacement or arthroplasty. Option A of side-lying hip abduction is an appropriate exercise as long as a pillow is placed between the knees to prevent excessive hip internal rotation with side-lying, especially during the earlier stages. Hip abduction is not a precaution for a posterior approach, but instead it is a precaution for an anterior approach. Option B of supine straight leg raise would be again an appropriate exercise as long as the individual maintains hip flexion of less than 90 degrees, which they should be doing during a supine straight leg raise. Since this option does not identify a specific degree, it should not be ruled out. Option C of side-lying hip external rotation would also be an appropriate exercise for this patient, since external rotation is a precaution for an anterior approach, not a posterior approach. And finally, option D of side-lying hip internal rotation should be avoided. The individual should not perform internal rotation, since this is one of the precautions for a posterior total hip replacement. This would mean that this is the correct answer, since again, this exercise should not be performed following a total hip replacement. So remember, following a total hip replacement with the posterior approach, the individual should avoid hip flexion greater than 90 degrees, hip adduction past neutral, and hip internal rotation past neutral to avoid possible dislocation since they are at an increased risk following surgery. Great job, warriors. If you have any questions regarding the different hip precautions for an anterior versus a posterior approach, make sure you head over to our content episode where I dive further into this topic. Never forget, warriors, you are powerful, you are strong, you are a final frontier warrior, and you will pass. For more information on the NPTE, please visit NPTEFF.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Thank you very much for listening. Till next time, have a great day and a powerful tomorrow.